All right, a lot of guys who are big and strong or have done a lot of training with high forces, high speeds tend to have a lot of external rotation, a lot of anterior orientation or tilt of the pelvis. This is going to change a lot of the length tension relationships of the muscle. And so what we're going to do is we're going to roll in one specific direction to help kind of reverse the influences or the directional pull that these muscles get kind of compensated into. So with respect to the VL, we're going to look at its attachment up at the hip around the trochanter, and then it's going to wrap just to the lateral side of that knee. So you kind of want to follow this curve as it slightly comes around your body. So what you'll do, we're going to roll proximal to distal. So you're going to find that greater troch. You're going to move a little bit anterior or towards your chest side, and then you're going to start to roll, and then you're going to gently turn that thigh into the roller until you get all the way down to the knee. Finish where that muscle attaches, and then move the roller up. And you're going to continue again, starting at that greater troch, just a little bit anterior, and then kind of rolling around the quad again. You don't want to roll too much and get on your rec fem. Really want to stay on that VL and its attachment to that lateral part of the knee. Now, for the lats, it's going to start in the armpit, and it's going to terminate somewhere around the backside of the rib cage. Again, this muscle is not purely lateral. It starts somewhat anteriorly, especially if I bring my arm forward, but it is going to kind of wrap around my rib cage. So I'm going to kind of get in this oblique sit so that I can lift my hips up. Again, this is going to help me just control the pressure because this muscle is very tender, especially once you get to about nipple line around the chest. So I'm going to start here. I'm going to push up to that roller, and I'm going to start to move around my body where that lat is. And it's not pleasant. And then what I'll do is I'll finish kind of on the back side. It's pretty hard to get focal with the foam roller here, so I usually stop somewhere around that lumbar and then reset. Now I'm back into that armpit, and then I'm going to just kind of follow that lat muscle all the way around, allowing that roller to do its work, and then I'll reset.